Or
They can
I can
introduce
even do them,
themselves
whatever.
while I go, while I do Kelsey. Whatever they want, whatever they want. Do you guys want to introduce yourselves, or do you want to just us to review what you emailed us?
We'll send them off. We'll send them off to let them introduce themselves. How's that? We'll make a decision.
Sounds
Go ahead. And we'll let Katie was on first, so she gets to start.
Oh goodness. So my name is Kathryn, or Katie Golab. I am a level 2 medical laboratory scientist at Wisconsin Diagnostic Laboratories in Milwaukee, Wisconsin. We're affiliated with Frederick Medical College. I help oversee our hematology department. I am currently now actually a second-year student in the Rutgers DCLS program, and I'm here to speak about advancing your degree and furthering your career opportunities with advanced degrees.
All right, Miles, you're next on my window, so you go next.
Yay. I'm Miles Tompkins. I work in Oklahoma City for Diagnostic Laboratories of Oklahoma as a med tech 2. I work at Integris Baptist Medical Center, but before I got into the medical sciences field, I worked as a hiring training manager for 15 years for companies like Hallmark, IHOP, Discovery Channel, those kind of places. So I have a lot of experience in interviewing and negotiating contracts and pay, that kind of thing. So that's kind of the area that I think I was asked to participate in. And I've given talks on that throughout ASCLS, my time in ASCLS. So, yay.
All right, Justin, you're next on the screen.
Okay. I wrote them down because I always forget something when this comes up. So my name is Justin Hanenberg. He, him pronouns, please. I'm a technical application specialist with ZEUS Scientific. I'm originally a clinical lab scientist from New Jersey, but I live in Los Angeles area now. My job is traveling across the US, helping laboratories with validation studies, lot-to-lot conversion, data analysis. I also do end user training and the kind of higher end troubleshooting that can't necessarily be resolved over the phone, might need to have a second pair of eyes on things. And my territory covers basically everything west of the Mississippi. I started off in a position of Greater Los Angeles and expanded since then. I'm also the incoming president for California ASCLS and the host for Lab for Life podcast.
All right, and then Stephanie, why don't you go ahead and tell us what you do?
Sure. Hi, everyone. I'm Steph Noblit. I'm from Philadelphia. So I am actually, my title right now is a legislative attorney. So I work for a small nonprofit organization called the Legislative Analysis and Public Policy Association, shortened to LAPA. So what I do is I do advocacy and policy work for topics on issues related to substance use, public health, and public safety, and criminal justice. So what am I doing on the call? Well, actually, I am a medical laboratory scientist first. So I actually have an MLS degree. I'm certified under ASCP. So before I went to law school, I worked at the hospital of the University of Pennsylvania here in Philadelphia. And I worked in the toxicology lab there for about 2.5 years before I decided to go to law school. So it's been really interesting to kind of have that clinical toxicology background and then going and now working kind of the policy side of substance use and seeing kind of basically how things played out like on the ground and street level, and now what policy is being implemented and putting into place. I'm still really involved with ASCLS despite, kind of doing a 180 in my career. So I am on the GAC, the Government Affairs Committee. I've been on that committee for a couple years. I'm the vice chair now. And then I was the co-creator of the Mentorship Program. And now I'm their special advisor.
All right, and it looks like Kelsey was not able to join us at this point. Is that correct, Jessica?
You're muted.
Sorry, I don't find her on the list. I was just looking.
Okay. Yeah, I didn't.
So Kelsey Lowe is a travel medical laboratory scientist. I'm just going to read the bio that she sent. She apologizes. She did wake up with a migraine. So, but she said she would be available via email. So I can drop her email in the comment section if you have questions for a traveler. But I'm going to go ahead and read the bio that she sent me. If I can get back to it. Okay, it says, hello, my name is Kelsey Lowe, and I've been a medical technologist for 3.5 years now, about 1.5 years of that time as a travel med tech. I decided to take my first travel job exactly 1 year after finishing my internship and working as a microbiology tech at Beaumont Hospital in Royal Oak, Michigan. It was something that I'd always thought would be an incredible opportunity, and I jumped at the option when my personal life allowed. I really enjoyed
I think we may have lost Jessica.
I think Jessica may have froze. Okay, so let's go ahead and move forward with this. We're going to open up the floor for questions. So if you have a question, you can go ahead and feel free to unmute yourself and speak freely. If you would prefer to put it into the chat window, go ahead and put it into the chat window, and we'll have Maria and Jessica and Ika kind of take turns reading them. And I know that some of them also have some questions geared up to go. So would anyone like to start off with the first question?
I can go. Can you guys hear me?
Yep.
Yeah.
Awesome. Okay, so what is the best advice somebody gave you to advance in the field of medical laboratory science and in the respective areas of the medical laboratory science field?
I guess I'll start. The best advice somebody gave to me, and I don't know if it's just general advice, if it was advice was actually spoken to me, or if it was just kind of like impressed upon me, was that set your goals and then do them. Don't think, oh, well, no, I can't do that, or I can't do this, or, you know, I don't feel like doing that. The biggest thing is like, you know yourself. So like, I know myself, and I know that I am a leader. I know that I advocate for my patients, and I know that I work towards making sure that they get the best care that they need. And, you know, as I go and as I work my way up in my career at my job, and then in getting my DCLS, that's going to help me advance what I already know to be strengths of mine.
I can follow with that. Something that I've had to work on through the course of my career is saying, I don't know, and being okay with not knowing. Early on in the career, I wanted to appear competent and confident, and that the idea that I didn't know something would have meant that I'm incapable or incompetent to do so. So I feared saying, I don't know. It wasn't, then I had an engineer I was working with who put it into the perspective of when communicating with customers. And customers, I mean, all clinical labs, research labs, all of our colleagues. It's that they may not necessarily, it may not be important to them that you say you don't know, but they need to know that you care. And so it was something that I had to learn of saying, when I had a question brought to me, say, you know what, I don't know the answer to that, but I know someone who does. Let me put you in touch with them, or let me get back to you, and then follow through on it too. So being okay to say, I don't know isn't important. It's not an admission of not being able to or not being able to comprehend, rather just acknowledging a limit in the things that we are knowledgeable about.
I'll follow up with that. In a cheeky way of putting it, the advice that I got was, if you're invited to an MLS party, go. But the point of that was, keep in mind that even though there's tens and thousands of us throughout the country and even more throughout the world, the medical science profession is such a tight-knit, well-known community. Everybody has 6 degrees of separation from everybody else. And so, you know, you have to make sure that you build a reputation within your career and within the organizations that you're part of not burning bridges behind you, because I guarantee you, anytime you're going for a job interview, there's already somebody that works there that knows your professor or worked with, you know, somebody else that you worked with before. And so just keeping in mind that, you know, you need to build your reputation in this field and make sure that you're somebody that everybody wants to get to work with.
And I think my advice, I would say, within reason, say yes to every opportunity that comes up. And this kind of goes off what the other three said, like having, you know, a lack of confidence, especially when you're starting out in your career. But if somebody approaches you or you come across you know, a project at work that you're asked to do, or even if you want to ask your manager yourself if you could even step in or try, don't be afraid to, because that's the best way to learn and get experience. And I've come across so many opportunities that I never would have thought, you know, would work out for me, because I've, you know, connected with the right people and they have presented me with these opportunities that have really furthered my career. So when the opportunity arises, don't be afraid to say yes. Now, the hard part is saying no then once you get a lot under your belt, but that's a different issue. But first, start saying yes.
So there is a question in the chat. Liz, I don't know if you want to take that one and read it. Trying to get you guys familiar with some of our leaders and putting them on the spot a little bit.
This is from James David Hollowell. Hi, everyone. I'm currently in moving vehicle, so I wanted to send my question through chat. I have a similar question. I was wondering if anyone had any advice for someone who is starting to work in 2 weeks. I am a little afraid and would love to feel more prepared.
I'll start with that one. I've got two pieces of advice to that. One, and I may be the only person telling you this, but there's no such thing as a stupid question. Always sit down, always ask questions. If you don't understand something, stop your trainer and just be like, hey, I don't understand. Can you please go back and talk about that? Because starting your job, your trainers and your coworkers and your bench techs want to make sure that you are the best tech that you can possibly be on the bench, and that you're the best possible, you know, version of yourself doing the work. So there's no such thing as a stupid question. So don't be afraid to be like, hey, I don't understand this. Please re-explain it. Or, hey, I'm curious about this. Can you tell me more? The second piece of advice is take your notes. You thought your note-taking days were done during school. They're not. Your training is a crucial time to be taking notes. Every single tech in my department has a little notebook in their lab coat pocket. Those are notes from their initial training. They're notes from policies. They're notes about changes that happen, or things that are crucially known, need to be known for their job assignments. That way then they can be like, oh, hey, let me check my notes. So that way then they understand and they make sure that they're doing everything appropriately.
As someone who was really bad about keeping that notebook in the lab pocket, learn from the thing that I didn't do. So, yeah.
Oh, sorry, Justin, didn't mean to cut you off. I wanted to, so hi, my name is Maria. I am a Canadian that has infiltrated your meeting. But thank you, Katie, for inviting me to this meeting. So I work as a medical laboratory technologist in Canada, which is similar to your MLS. But I wanted to reiterate what Katie was saying, because I recently started a new position at a reference lab for platelet immunology testing. And you know, all the questions I've been asking and all the notes I've been taking has really helped me in this new role. And I also wanted to ask a question out in regards to everyone in their MLS career, going back to the beginning, knowing what you know now and having the experience you have had, is there anything you would have done differently?
We'll come back to that question so we can get down to Miles and Stephanie for their answer to the first one, but we will come back to that question. Miles, do you have any advice for new tech?
Well, I was going to ask
hiring
Justin if he
manager?
had anything left to say. I'm sorry, since he got cut off. Justin?
It's all right. I do. If we'll field it back to me, I'll make a quick note then that one, take a notebook's a good idea. Something to Kathryn's first point about asking for more time or just more question, sitting with the, can we go over this again? I felt like that was tied into that idea of learning how to say, I don't know. And really just being okay with sitting that, hey, this is going to take me a couple more times to wrap my brain around. Can we go through it one more time? One of the other things that I was thinking of when there was the mention of you want to feel more prepared. If there's anything I've learned from every job that I've taken so far in my professional career is that you're not going to be. And you need to be kind of okay with that. And that you're going to learn the skills as you go along. So just knowing that you're putting the foot forward and coming in with your strongest intentions to learn and to care about what it is that you're stepping into, that's the most prepared that you can be outside of the conventional knowledge that you've taken away from school books.
Well, and my part to answer that question is kind of duality again of keep in mind that your first 90 days of your job typically is not just learning to do the job, but it's seeing how well you work with others and see how you fit into the environment of that workplace. So one of the things that I make sure to tell, graduating students here is make sure you pay attention to everything and be engaged with everything. Even if you've already known it and you've known it for years and it's something that seems so menial, if you're paying attention to your trainer, even when they're telling you the most basic information, it shows you being engaged and it develops that rapport and relationships that shows that you're going to be in that environment, that shows that you can work with them. That's the biggest thing that I could say is keep in mind that first 90 days is not just about learning, it's about engaging with each other.
So the day before, really the night before my first night of work in the lab, I was sitting at my kitchen table with my clinical chemistry book, reading all about GCMS and LCMS. And I'm sitting there and the hours are going by and I'm hyperventilating because I don't know any of this stuff. And I'm trying to learn as much as I can because I'm so terrified that I'm going to get there the next morning and they're just going to throw me onto the instrument and say, okay, here you go. And I don't know how to use it. And eventually I was like, okay, I need to go to bed. And, I start work the next day and you're starting from basically all right, here's your pipette. I think we forget when we start a job that they have to train you to do the job. It doesn't matter if you spent, 3 days or 6 weeks in that particular lab during your rotations. That's nice and all, but they have to train you for that position, regardless of what other experience if you've had in that particular lab as a student. So don't be afraid they're just going to throw you off the deep end when you get there that first morning, because they will take the time to train you. And, while the training is important, make sure you do all the things that the other three said, like having your little notebook, asking questions, not being able to, or not being afraid to ask for help when something isn't clear, or you need, something to be repeated. But, don't panic that first morning. You'll make it through.
And I want to go back actually to something Miles said about, working with your trainers. The trainers, I'm one of the principal trainers in my department, but the person who's above me in training students has been there for over 40 years. We all talk and we all watch how people respect her because she has certain limitations to what she can do. And if we notice techs aren't interacting well with her, aren't interacting well with others during training, we all kind of get this knowledge of, okay, this person might be a little bit hard to handle at this job because we all look at how we're all going to interact. And if you're bulldozing over your trainers, that's not something we really want to see in a lab. We want people to work collaboratively. Yes, we get to have the book knowledge, but that doesn't necessarily replace bench knowledge. We want to give you the bench knowledge that you need to work at the job.
So, and I'm going to kind of tee off like what Katie just said. Those of you who will be, are not quite to your internship. I worked in the blood bank for 11 years before I started with ASCLS. And one of my jobs was to teach the blood bank portion of the internship. And I always told those students that your internship is your longest job interview of your life. So when you go into your internship, the people that are working with you are happy to see that you know everything, but they don't want to know it all. So remember that when you're not on time for that internship, when you're bulldozing over, like Katie said, your fellow students, that internship truly is the longest job interview of your life. Katie, you had a question. Katie, you had a question for Maria, or I'm sorry, Aika, was it?
I just wanted to add in something quick that I've been learning on my new job. I know I'm not a panelist, but don't forget about your procedures. Feel free to ask tons of questions, but if there's something that you don't remember or you're not sure about, don't forget about your procedures, because they're always there and they're going to have all of the answers. And that's something I'm still remembering to check on too.
Mm-hmm. Yeah, the question that we got from Maria was, knowing what we know now in our careers, what would we do differently when we started? I don't think I would do anything differently. I know my personality. People correct me when I say it, but I still say it. I'm a little bit like a bull in a china shop. I kind of just bulldoze my way into stuff. I respect my trainers and I absorb everything that I possibly can from them. But I'm one of the people in my job where I look for case studies to write up. I look for different ways we can change our policies. I look for different procedure changes that can make our workflow more effective. And because I do that, and because I kind of just go for it, I have been able to, advance my career as I have. I've made friends with the pathologists. Everybody in the hematopathology department knows me by name. They know my face, they know what I do. And if the hematopathologists have a problem, they actually come into the lab and ask, where's Katie? Because they know that I will fix the problem. So I wouldn't do anything differently, because the way that I've kind of made my stepping stones, I have stepped myself into going into my DCLS. So I kind of, even though I didn't think it was where I was going to go, because when I graduated school, and my program director loves reminding me of this, I did not want to be a DCLS. I didn't want to be a doctor. And I thought that was not in the books for me. And she saw it though. She knew that I was going to step my stones in that direction. And that's the way I've gone. So I don't think I would have done anything differently.
I don't think I would have done anything differently in where I'm at now. I guess if I were to do it differently, I would do all the same things that I'm doing, just more of it. More involvement with ASCLS, more questions, more committees, and really investing myself further. I think that's where tipping my toes and staying in the shallow end of the pool was fine as exposure, but looking back at it now, I think I could have pushed a little bit more.
Mine's pretty similar as far as my overall career path goes, as I wish I would have started sooner, since I was a very late student in the medical technology program and everything else. As far as the career itself, the only thing, and it has to do with my previous advice, is when I was doing my internship and all that, I was working, or I did my internship at a place where I knew I wasn't going to get a job. It was basically a military hospital. And since I was not military, I was civilian, there was very little chance of me ever getting hired. And so instead of taking that seriously, like Andrea was saying, as taking it as a job interview, I just kind of looked at it a very different way. And I got mixed up in a little bit, not drama per se, but just got caught up in other things other than focusing on my long-term career.
I don't think I would change anything either. I think if anything I would change, I wish that during every step of the way I had more confidence in myself, and believed in myself more. But as far as where I started and where I end up, I mean, it was definitely never something, like Katie said, never anything I thought would happen. But yeah, I mean, I'm happy with the path my life and my career has taken me, but I just wish starting off from the beginning, I would have had, more confidence in myself. Was able to see myself the way that, my colleagues and especially a lot of people in ASCLS were able to see me.
You were confident you were going to do good things, Stephanie.
All of it.
We have a question that Sarah Oswald would like to ask Miles specifically. So Miles, we're going to put you on the spot.
Oh God.
Go ahead, Sarah.
Hi, Miles. I'm Sarah.
Hi.
Hi. I'm in Grand Junction, Colorado, and I have my clinicals this fall, and I'll be graduating in December to get my MLT. So this is my first foray into the medical field. I actually have a bachelor's in English that I got a long time ago. I'm almost 40. And I have a lot of questions about salary negotiation and salary at different hospitals. It seems like I don't even know, first of all, there's so much taboo in our society about talking about money and salary. I don't actually know what I'll be making.
It's not just our society, I promise.
Okay.
Yeah.
Like my husband was like, so what do we think we're going to be making here? And I'm like, I have no idea. And and I know that there are several different hospitals in the area that I could potentially work at, but you don't find out what a hospital offers until they're making you a job offer.
Right.
And I don't think I should be going through the interview process with all these different hospitals just to find out what they offer. Like how do you negotiate that? I mean, I've even looked at like Glassdoor and they don't have anything unless somebody like volunteers the information. It's just not out there.
So this is a multi-pronged question. I'm going to try and condense it down as much as possible and be quick about it. The first thing is know your worth. It doesn't matter what the hospitals are offering. It doesn't matter what everybody else is doing. First, research what you're worth. And one of the ways you can do that is there are online resources. I know ASCP used to do a wage survey every other year.
They still do. They just published the 2019.
Okay. So you can get on that and you can look by region, by career, by whatever, and look up what the base salary is. Now, keep in mind, most of those are the average from everyone from newly graduated to about to retire. So you need to extrapolate that information, really sit down and know your worth. The second part, really fast, is that you have to be willing to walk away. And I know that's hard, but that is your only bargaining chip in negotiating a salary, is being able to stand up and say, I really appreciate this, but this is what I'm looking for, and being willing to get up and walk away from the table. That's your only bargaining chip. The third thing is being willing to balance what you consider salary. Going into this, a lot of people go, okay, the salary is dollars and cents, and that's it. What my paycheck is going to be at the end of the week or the end of the month or whatever. It's more than that. It's how much money they're investing in you. Is there a 401k? Is there paid time off? How do they handle sick pay? How do they handle health insurance? Is there a per diem if you travel? There are so many different things going into this that you have to take into consideration as well. And so that needs to all fold into this. And then the last thing that I can tell you is, if a job is being cagey about what they're willing to offer and pay, then that should be a red flag for me. That's always been a red flag. I tell people, like, maybe not in the first interview, like if typically you'll do a phone interview first or a quick, get to know you interview. I wouldn't necessarily bring up money then, but when they turn to you and ask, hey, do you have any questions for us? That should be one of the questions you say is, what is the salary range that you look for a person in this position? What is the starting pay? Some places have caps that up to your education level and up to your experience level, you're done. If you hit that number, that's all you're ever going to get, unless the company changes that. So those are things to keep in mind. But when they give you that opportunity to ask that question, And these are the people that are going to see your paycheck. So there's no reason for them to be cagey about it.
Mhm.
If they are, I would consider looking at other places.
So the other thing that I would recommend you guys do is, I don't know if you guys are aware of this, but a lot of so if you have a medical center that is connected to a state university, they have to post salaries somewhere. So I'm going to drop a link into the chat right now. This is California. So, you know, California is not going to be the same as everyone. I used to work at University of Michigan. Unfortunately, that was not anonymous. So you could actually look up what now I'm far enough out of the system, you can't look up my actual salary, but you used to be able to look up people's salary for that person. So if you can only imagine, that was a lot of fights within the laboratory. Like, why do you make, you know, more money than I do? But so you said you're from Colorado. What I would do is try to find a state hospital that is close to your area and see if they post it online somewhere. So the link that I just posted, you can see there's laboratory assistants, there's clinical laboratory scientist 1, clinical laboratory scientist 2. You'd have to do your homework a little bit just to make sure that how they're classifying the jobs is what you would be going into as a base, because you know, some of us are MLSs, some of us are CLSs, but that information is out there for state institutions.
Yeah. Thank you so much.
Nikki Bouza just dropped into the chat because this is related. She said, check with your program or clinical director, because sometimes they have that information as well. And then I'll just throw my 2 cents in as well. So my workplace is unionized. So I don't get to negotiate what my pay is. My union does that for us. So I know that everybody in my CLS grouping, so everybody with 4 years of experience at my lab gets the exact same pay. So, but again, a union is a 2-edged sword. So my wages get negotiated every 3 years. So yes, I get a pay raise every year, but that may or may not be market comparable. My wages are actually behind market value in my area because my union didn't enough big of a wage increase the last time we did a contract. So there are other factors that go into it if you do have that type of hospital experience or go to that type of hospital.
Okay, we're going to go back up in the chat window a little bit, and we have Denise has a question. If you've had other experience in the medical field, example, working as a medical assistant billing, does that increase your chances of getting higher pay when you first start working as an MLS?
So I don't have that knowledge just because I did start as a lab assistant at my clinical site, and then I went to where I currently work now. But again, my workplace is unionized, so I don't have that free ability to negotiate my wage. That may affect people otherwhere. Justin and Miles might be able to respond to that better.
I have some thoughts. This is not me in particular, and then thinking also on like, what would I do differently? I would have been a phlebotomist or gotten some kind of medical exposure and medical job exposure while studying for MLS. And so does it increase your chances of getting higher pay? My question is, do you think it does? Do you think it deserves it? Do you have skills that you're bringing to the table? To answer with what Miles said, who took the words out of my mouth. What do you worth? Sorry. What do you think? So if you believe and you can tie it and sell it to the person interviewing you, because an interview goes both ways. You're interviewing them as well. And so if you really believe that there's something you're bringing to the table from your medical assistants or your billing, say it. And you know what? Put $1 on it. What do you think it's worth?
And just to tack onto that really quick, number one, absolutely listed on your resume. It will help your chances of getting hired because you're already familiar with a medical system. That is something they will look at. Even if you volunteered at a hospital, list that because it does show you know how to work a medical system. But the flip side to that, as far as salary goes, is it depends on the type of job you're applying for. Because if you're applying for a reference lab job, I don't know how much that would boost it. Maybe that would be giving you a quarter more an hour versus $1. Whereas if you're working for a, like a big medical center or a clinic or something like that, where they do that in-house and you would be able to help translate or be a liaison for that department, absolutely put a dollar amount on that. It makes it worth it.
Steph, you have anything to add?
Well, when I was a student, I did work, like I had a student job working in central processing, and that definitely helps later on. I think it helps me get hired in my position. Unfortunately, I don't think it helps raise my rate of pay, but like Miles was saying, definitely put it on your resume. If anything, it will help you likely get the job. Hopefully that will turn out in a small boost in pay, but you know, just getting the job itself because of that, I think is also, it's not something to, you know, be sad about if you don't get the pay. At least you know, have the experience, and you'll always have that experience. So later on, then if you go for more of a managerial type or some other more specialized area of the lab, that then could come back and help you. And at that point, that might be a pay boost. So, you know, always carry that with you. If it doesn't help now, it may help then later on down the road.
In the health system, there's a major health system down in Northwest Ohio. And if you had an associate's degree or a bachelor's degree, depending, so if you're a phlebotomist with an associate's, you had a pay raise. If you were an MLT with a bachelor's, even if it was just a related science, you would get more. So sometimes if you have an added degree, sometimes if you have a specialist, they will pay you more. Not all places are like that though. Liz, why don't you, I know you put it in the chat, but you actually have a little bit of experience with this particular question. So why don't you go ahead and speak on that? You have to unmute yourself first. Oh, there you go.
So I was actually a CNA for 6 years before I became an MLS, and I can say for sure that it has helped me not only get jobs, but negotiate that higher salary in my jobs. So for sure that those experiences in other healthcare settings can definitely help you in your MLS career.
Yeah, and again, you know, that's being a certified nurse's assistant, and so sometimes that's the difference. If you don't have a certification, or if you don't have a degree, you know, that's really where I have seen the increased pay for those kinds of positions in my experience. The next question we have is another question for, oh, actually, nope, I missed one. Biz Fisher says, what is your dream laboratory job look like? What does it look like? Dream laboratory job after graduation.
So hi, Biz, good to see you, because she's in my DCLS program with me. I think she's a year ahead of me. My dream lab job, so I really see myself after I graduate with my DCLS doing something like Dr. Brandy Gunsless. I would be a utilization director at my laboratory and at my medical facility, and doing a lot of physician education, because I see that a lot. Our physicians do a lot of what I call blanket ordering, where they order an entire, like just this monstrous blanket of testing that they don't absolutely need, or that feels very wasteful, or there's a lot of duplications in it, where until we get the education, shotgun ordering, where once they get the education, that we can limit that, and we can now again go back to patient-centric care. And we can do more specifically for the patient. So like, we don't need to do 5 cell counts on 5 different BAL specimens. We can pool that, because that type of a test is more for a very broad interstitial lung disease. It's not necessarily for specific interlobule malignancy. Malignant cells in BAL don't necessarily mean that there's malignancy in that spot. It just means that it's picking up malignant cells, which is where cytology and lung biopsies come in more handy. So if we're utilizing and we're making strides to utilize laboratory better, which is again what I would love to do with my DCLS, we can then help make patient care more centric.
Quick question. Are we speaking on like what's the overall dream of career, or specifically in regards to post-graduation?
think it's a little bit of both.
Okay.
Whatever you want it to be.
Yeah. What do you want your dream job to be, Justin, in lab?
Well, it is. And I guess the two are, in a sense, the same. For me, I want my own laboratory. And I put a lot behind the word laboratory, because when I say laboratory, what I really mean is laboratory system, community care, patient-centered care. But more importantly, why do I want that specifically? To be a cultural leader in laboratory. That I look at people like Katie and think they're going to be they may be a better DSCLS than I could ever be. So you know what? I just want to provide a place and a culture that lets them flourish. And so that's what I hope. And that's what I sit and I dream about this, and I have notes upon notes on what this looks like in my head. And that's something else that I would say for your dream, whatever it is, write it down and keep it close to your chest for now. Ideas are most vulnerable in their infancy, but more importantly too, 6, 10, 20 years down the road, especially those first few years when you're an infant, like when you're grinding through and you can't even remember, why did I even start this project? You can go back and take a look at what it was that emotionally invested, how you had emotionally invested into this project. So for me, yeah, I want my own laboratory. I want my own laboratory system. I want to hire amazing people and create a culture of excellence, and that resonates out into the public world, and just contributing to making laboratory professionals an amazing part of healthcare.
Just to follow that up again, my dream job in theory in laboratory probably doesn't exist unless Justin gets his lab and comes up with this idea too, and go wink, wink, nudge, nudge. I love the job I'm in. I'm a generalist on night shift. I have such hands-on with every single instrument in the laboratory. I don't feel pigeonholed in any way with anything I do. I will do everything and it's for a large hospital. So we have a large night staff, but I still get to touch every instrument and be part of so many different things. But the only thing that I would alter about it that would make it the dream job is maybe part-time as well, participate in research and do part of medical laboratory research. I would love to have a job where I can do the generalist side and the research side, congruently somehow.
Well, I'm not in the laboratory anymore, but I would say my fantasies are, so one thing that was always kind of inspired me onto the career path that I'm on now, was I remember at my first legislative symposium, Patrick Cooney, who was our legislative consultant for ASCLS, he had said that there has never been a medical laboratory professional on Capitol Hill. So in some crazy fantasy, I would like to be the first one, but I don't know if that will ever happen. But I guess another fantasy is, I guess someday when Jim Flanagan retires, I might like that job. I think that would be fun. I'm always jealous of when on the GAC calls and Jim gets to talk about all the government meetings he's in, and I know that's probably really boring, but I don't know, I think that would be cool.
Oh, Julia and I might have a new boss. I think that we'll be okay with that. All right, so we have another question for Miles. Miles sure is getting picked on tonight.
Oh, geez. Lucky me.
Any advice for someone starting out later in life? How do you overcome the limitations, and how do you make yourself more marketable when the competition is a decade or two younger?
Well, it sounds cheesy as all get out, but it's the truth, is take that and use it towards your advantage. One of the things that when I decided to go back to school for medical laboratory science, at first it was really daunting. I was really freaked out about, oh my God, all these people are younger and have more energy and more enthusiastic and have, all this stuff. But then I also realized the advantages versus the disadvantages of, yeah, they're all excited, but they don't have the study skills and the life skills that as a non-traditional student is the word I'll use, that we would have as already having the work experience and already having the life experience and knowing how to juggle those things. So in areas where I thought, you know, where I was struggling a little bit of going, oh, how am I going to, you know, get all this information into my older brain? They were struggling on other sides with dealing with life and dealing with new experiences and everything else. And so it still sort of evened out and balanced out. And we were still all on the same level. As far as, you know, going into the workplace, sometimes it can be seen as a disadvantage of having more work experience because you would normally expect a higher amount of pay, or being older expecting a higher amount of pay. But the thing to keep in mind is, yes, you still deserve that. But you have to sell it on the fact that you do have experience. It might not necessarily be, you know, MLT, MLS, CLS experience, but you do have the experience and the knowledge and the resume to back it up. And so those are things that you can work towards your advantage as well. And that's actually in my interview exactly what I said is I have zero experience in medical laboratory sciences as a job, but what I do have is a work ethic that I've developed over the past 15 years that you can bank on, that I will do the best job I can. Can't hear you anymore.
Oh, sorry.
Oh, sorry.
I have a bad habit of hitting my mic on my cord here. How important is continuing education that isn't always in the realm of the exact work that you do? Do you find it beneficial to delve into other areas or realms to build out CEs and knowledge in your career?
Well, I know ASCP requires that you do a certain number in each area. So you have to have like 2 blood bank credits, 2 micro credits, like a heme credit, chemistry, all of that. That's for the MLS at least. That's in general, just to kind of keep you all rounded. I found that if you want to go into like get your master's to go into, you know, education where you're going to be a program director or an instructor in a CLS program, or me in my DCLS, making sure that you are staying up to date on different progress in each area of the laboratory is very crucial to making sure that your knowledge is up to date. If I'm not going in and getting extra microbiology CEs, if I'm not going in and getting extra molecular CEs, my knowledge technically is 4 years old because I just have my knowledge of what was going on in micro when I was in school. So by keeping up to date on your CEs in other departments or in other areas where you may not traditionally work is very beneficial to staying a well-rounded tech, especially if you're not in a generalist position. So my laboratory, I'm in a hospital-based reference lab essentially. So I work in just hematology. That's all I do is hematology and some chemistry depending on the area where I'm working. If by some weird happenstance, I have to go and find another job, technically my skill range is very narrow because I only worked in heme. But if I keep up and say, I can go to, you know, the hiring manager and say, look, instead of doing all of this hematology continuing education, I did all this extra micro continuing education. I did all this extra chemistry CE. I did all this extra blood bank stuff. My knowledge is up to date in these areas. You just need to get me trained on the bench. And that's a benefit moving forward.
I think we need to remember too, that what we're doing, even though we are maybe separated by physical walls and departments, what we do for patient care is the wholesome part of things. So what happens in micro affects hematology, which affects immunology and blood bank. So by extension, you keeping up with those other departments indirectly does inform whatever job you're in currently. So even if you're working in a reference lab, understanding how this aspect of immunohematology will affect chemistry over here will by proxy improve your skills within whatever your specialty is. So I think when we want to remember that we are trying to take care of the whole of the patient.
And I'm going to throw in there, if 2020 has taught us anything, it's to expect the unexpected. I got a Saharan dust storm outside. So, I mean, I'm just going to put it out there of, you're saying, oh, well, this is outside my range and outside my bubble. How do you know that? Because if you're going to sit there and tell me, oh, well, there's no way, if I would have told you you would have asked me last year, I would have said, I'm never touching viral PCR. I have no idea about viral PCR. I don't care about viral PCR. Never. Well, then guess what? This year, because my hospital had to get rid of all elective services, they were furloughing lab staff. And one of the things that they did is said, hey, instead of being furloughed, if you want to move over, because they wiped out our HLA department for the time being and turned it into a full COVID testing center for viral PCR. And guess what? Because I kept the transcripts, which asterisk, keep all your transcripts in a notebook in your locker of everything you've ever done throughout time, because you will come in handy. But I was able to go in my locker, pull out, hey, this is the continuing education I've had on viral PCR. Let's go. And that was it. So, you know, that's something I would stress is that. And I guarantee you, 5-10 years from now, when you're looking at the instruments and the methodologies and the standards and the procedures and all of that stuff, you're going to look back and go, was I in the Stone Age? You know, you have to keep up with the C's of all of that, or else you're going to get left behind. It really is the nature of the beast. Mm-hmm. So.
Steph, you have anything to add?
I would just say, like, in addition to your science CEs, also take it upon yourself to also make sure you're spending time looking into kind of laboratory policy and what that means. Also kind of like the policy or sociological aspects behind our testing. Like, it's one thing to do the COVID test, but then another thing to do that test and also understand what that means for the person and also society as we go through this pandemic. And I think it's important to kind of understand the fuller picture outside of the lab.
So I'd like to ask everyone, how has ASCLS membership and involvement helped in your career?
I'll start with that one. And hi, Ika, good to see you. Because speaking with what Stephanie mentioned in policy and how we know each other through legislative day, and your hair looks great as usual. So ASCLS has helped me in a number of ways that it's hard to really pinpoint anything really directional. Though what I would say is one of the most prominent that I think that informs everything else about what ASCLS has brought me is that it's a community and a culture of people who really feel positively and strongly believing in the value of laboratory medicine. And I think when we can go into work, and I'm thinking about the people that we may work with that might get that label the toxic tech, or the sort of negative aspects that can come around in the stressors from our jobs. It's nice to have a place that we can go where we have people we can talk to a little more frankly, a little bit more friendly or intimate relationships with, that really do believe in the value of medicine and our place in it. Mm-hmm. And with that being said, you get, along with all of the ideas, not just a place to go geek out about them, but you get to hear about what's going on in this area of the lab or anything else, so that we don't get locked into the Stone Age, like Miles had mentioned. So I think just having that community and that positive attitude has helped me reinforce and stay strong in my own attitude about what I want to bring in each and every day when I walk into the workplace. The other things too is just the social networking, the professional networking that I've made. I've made some really great friends. I've also met some good colleagues and and even some of the career trajectory that I have, specifically moving into field applications, I directly tie to attending the national meeting with ASCLS when I was looking for a change and being able to find some direction there. Not only direction, but mentorship.
Yeah, I'll agree with that on a number of points. ASCLS got me onto my DCLS track. I did not think that I was going to be a DCLS until I heard Brandy speaking at the Chicago conference, where she talked about her DCLS residency. And I actually ran into her a number of times throughout that conference, to the point of where we've both said we're seeing each other too much. And that got me onto that trajectory of, hey, I want to make a change in medicine, and I want to show them that the lab is here and we hold a crucial part of patient care. And that's what the DCLS is allowing me to do. It's also, again, like Justin said, networking. I have so many great friends with the ASCLS. And as you know, my boss actually said to me yesterday, because I told him, technically I'm on vacation, but I'm doing this conference next week. And I told him all the things I was doing. And I'm like, yeah, I'm going to, even though it's a vacation, I'm going to be busy. And he's like, you may be busy, but you're building a career. Anybody who has a big name in medicine, in ASCLS, in ASCP, anybody who's a big name has been on committees, has been in multiple different professional networks, has been in multiple different professional societies, has taken the steps to get themselves involved in national affairs for their career, to then, you know, build themselves up on stepping stones and start making a career with what they were doing. So ASCLS is a great place to start taking those stepping stones and starting making a career for yourself.
And I would just add to that, that taking that career and turning it into a passion. And that's what I've enjoyed about ASCLS, and what brought me to it is, you know, again, we're doing this for a job. Let's not kid each other. We're doing this as a job, and that can become day in, day out mundane, no matter what you do, no matter how you do it. And what this has done, like attending the national meetings and attending the state meetings and going out and representing ASCLS and having it represent me, it builds a passion for that career to where it no longer becomes the mundane day in, day out. It reinvigorates me every time I do something like this. And then just a quick aside with that is, you know, it also, like that small community of medical laboratorians is, you know, if for some reason I decide to drop everything and move to New York, I know 3 people in my phone now that I could call up and be like, hey, what's the jobs like up in New York? What do I need to have to move up there? You know, what can I do? Or, you know, anywhere in the country. And now apparently Canada too. Hi. So, you know, it helps build that network of being able to always have security in your life with what you do.
Yeah, I agree with what everyone said. Sorry, Justin.
This comment.
Agree. Yeah, I feel like I've owned almost every opportunity I've had in my career to ASCLS. Like I wouldn't have discovered laboratory policy and government affairs without having that opportunity to be on the committee. I've had the opportunity to be published because of meeting the mentors that I met in this community, and that's on top of making so many friends and connections. And I think it's always just so powerful, like the other 3 I've said, to be able to really say, you know, almost somebody in every state. And I think the networking aspect of that is just so powerful.
Well, and I'll also make one more point. It's also, you know, the mentorship aspect of it as well. You can find somebody in this organization who pairs with you really well or is doing what you want to do, and you'll be able to talk with them, get to know them. Like you help lead the mentorship program. I think my mentor is on this call too. Your mentors will make a huge difference in your career. And if you find someone in your professional organization who's a mentor, or, you know, just someone at your day job who's a mentor, it makes a huge difference in how you do your career and how you do your day job. So your mentorship is also a big benefit to being a part of ASCLS.
May I add just like a tiny thing?
Yes, of course.
Okay. I was just saying, like, right now in particular, it's so nice to have actual experts in our field to go to validate information, because people come to me, my friends and family, about the pandemic and the COVID and all of that. And I at least know that, you know, what I don't know, I probably personally know someone that does know for a fact, and it's true, valid, actual information. And that's huge to me right now.
And I just want to read, make sure you guys saw what Ali Storla posted, because this is really important too. It's a great place to learn leadership skills and build your resume. It gives opportunities for growth and development that can translate to more opportunities at work. And that's definitely very true. And I myself, not only did I get my internship because of connections with ASCLS, because I was the first student from my university to intern at University of Michigan with the help of a mentor of mine, Suzanne Butch. She helped get that internship going with my university. But then also Suzanne was the administrator for the blood bank at University of Michigan, and that helped get my job there. And the support of everyone in my region and my state is what got me my job with ASCLS, which I would not have known about had I not been a president of the Michigan chapter at the time and saw that come through the leaders communications. So I think a lot of people in ASCLS have their ASCLS story.
Really quick, just to add to that, is also just a quick aside of when I became president of our state society, that was the largest raise I got at my job after renegotiating my salary. Doesn't work for everybody, but that is a bargaining chip.
Yeah, and there's some questions about the mentorship program. We'll have more information coming out about the next round of the mentorship program very, very soon. We do actually have software now, so the mentorship program will change, but it's still going to be formal. There's still going to be a lot of information for both mentors and mentees to use. And if you don't think that you're a mentor, I want you to think again. So when the applications come out, you can be a mentor to anybody who needs some information about your life experience. So when you see the mentorship program revisited, you will see some connections that you can make based on your work-life balance, as well as your skills within a laboratory. Because there are some of you who are non-traditional students who have now graduated and you've been in the field a couple of years. And the information you have for somebody else who is in a similar situation is just as great as somebody who has been in the field, 15 years or 20 years. So everybody has something to offer everyone. So when you see that call for both mentors and mentees, please consider signing up, because we need all of you for all of your special sets of skills that you have. Now we've run out of time for this. We allotted an hour. I hope that we can do many, many more of these in the future throughout the year, because I think this has gone really great. I want to give a little special shout out to Jessica. Had she not froze up a couple of times, she would be leading this, because she was the person that reached out to all of our panelists and got this together. And we cannot
thank God for freezing computers.
I guess that's what we're gonna be up against a little bit this annual meeting, is maybe some freezing computers, maybe some fun. So we'll see. But thank you, Jessica, for all the work you did. Now, I am going to ask you guys, I'm going to put you into 2 breakout rooms. I'm going to ask you guys to put a little notation